not just about holding the teeth together. It is about restoring the function, preserving smiles and giving mobility a second chance. Hi, I am Dr. Angeline Fiona, Assistant Professor in the Department of Periodontics. Today, let's dig deeper into why, when and how of dental splinting all in one session. So now, let's go into the topic. First, what is one of the common complaints which are addressed by the patients coming to the outpatient department of periodontics? It is nothing but the mobility of the teeth, right? So, you have got a patient with mobility of teeth. What and all you have to do? When and all you can splint for the patient? Those are the things we'll discuss in today's topic. So, mobility. You have got a mobility patient with a mobility of teeth. First, you have to assess the grading of mobility. How will you assess the grading of mobility? We'll use the Miller's Mobility Index for assessing the grading of mobility. How will you use it? So, we have to take the ends of two blunt instruments and have to hold the teeth within the blunt instruments and check for any horizontal or vertical movement of the teeth within the socket. So, if it's grade 1, there will be less than 1 mm of movement of teeth in the horizontal direction, and if it's grade 2, there will be greater than 1 mm of movement of teeth in the horizontal direction, and if it's grade 3, there will be greater than 1 mm of movement of teeth in the horizontal and the vertical direction within the sockets. Other than the Miller's grading of mobility, we can also use certain electronic instruments like the periotest and the periodontometer to check for the mobility of the teeth. So now, you have come to the conclusion that a patient is having a mobility of their teeth. So, what will you do next? When will you splint them? So, to know that, we have to know some facts about the splints. So, coming to the next, what is the definition of a splint? A splint can be devised as any device, an apparatus or appliance which are employed to prevent the motion or the displacement of a fractured or the movable parts. So, what is a periodontal splint? A periodontal splint is an appliance which are employed to immobilize and stabilize and hold the mobile teeth in a functional position. So, when will you splint? So, before going into that, we will just see some history of how the splints has emerged so far. So, in the year 500 BC, people have found that the Egyptians have used certain gold wires to splint the teeth which are periodontally compromised. Later on, it has led to the development of silver wires for using in the dental prosthesis. And later on, in 1951, Arvins has found that he can use the usage of self-curing internal splints to temporarily stabilize the mobile tooth. And then in 1957, Harrington has found the usage of cemented stainless steel wires for splinting of teeth. In 1993, a scientist named Alvarez has concluded that a teeth which is avulsed or subluxated can be splinted so that it will avoid the motion of the tooth, which will cause disturbance to the reorientation of the periodontal fibers. And later on, the splints has emerged so far and has been widely used nowadays for splinting of periodontally compromised teeth. So, when to splint? To know when to splint, you have to first rule out the etiological agent that is causing the mobility of the teeth. First, we have to check whether the periodontally compromised teeth is due to the infection or the pathogen induced marginal inflammation of the periodontium leading to periodontal pocket and the attachment loss and the bone loss. And then we have to rule out whether it is due to the primary occlusal trauma or secondary occlusal trauma. You know, in case of primary occlusal trauma, the occlusion itself is going to be injuring the periodontium. Whereas in case of secondary occlusal trauma, your reduced periodontium cannot withstand the occlusal forces. So, you have to assess these things radiographically. First, how to assess? We have to check for any widening of periodontal ligament, and you have to check for the amount of bone loss that has occurred in those regions. After assessing these things, first thing what we have to do, if it is because of occlusal trauma, we have to treat them by doing the occlusal adjustments, which can be with the use of any occlusal splints or selective grinding or coronoplasty. And then when it is caused due to the periodontal infection, we have to do the proper mechanical block control, which is your scaling and root planing. Okay, now you have done all these things. Then when to splint for the patient? You have to wait and check whether the widening of PDL has resolved. If it's not resolved, then we can go for the splinting of the teeth. And splinting can be done only when the patient has a masticatory dysfunction as well as their chewing comfort is disturbed. So these are the considerations you have to do before splinting a teeth. So now coming to the rationale for splinting. When and all you can splint a teeth? You can splint when the patient is having any parafunctional habits like the bruxism, and when the patient is undergoing regenerative periodontal therapy, but the mobility of the teeth is going to hinder the new attachment that is going to occur after regeneration. In those cases, we can splint the teeth. And when and all we can splint? It can be done when the patients are requiring post-orthodontically due to the reversible mobility, and for patients who are having supra-eruptions. If there are supra-eruptions, they will be prone to more potential periodontal problems in future. Oh, right. Then we can also do splinting for patients who have undergone secondary occlusal trauma to distribute the forces equally to all the other tissues also. So splinting is mainly recommended for progressive tooth mobility cases. So now coming to the biomechanics of splinting. How will you do and what are the things you have to consider before splinting the teeth? The loose teeth, because we are doing it for mobile teeth. So the loose teeth should be splinted to adjacent firm teeth. When you are having more number of mobile teeth, you can also include the adjacent quadrants for splinting. And then when you are splinting, you can ensure that the teeth will be firm mesiodistally, but they may be slightly mobile buccolingually. And this splints can act as an orthopedic brace which helps in holding the retention of the mobile teeth in a functional position. Other than these things, what are the things to be considered? If you are selecting an abutment teeth for splinting, the abutment teeth's periodontal membrane should be higher in number, higher in size, and they should cope up with the mobility of the other teeth. And the amount of remaining bone should also be either half or 2/3 of the root of the teeth. So these are the things which has to be considered before splinting. And now coming to the indications and the contraindication, for whom and all we can do splinting. As I said earlier, if we are going to restore the masticatory function for the patients and ensure stability, we can do splinting for that patients. And if the patients have undergone orthodontic treatment and have reversible mobility, we can also splint for those patients. And the patients who are having acute periodontal trauma, we can do splinting. And the patients with increasing mobility which have not responded to the periodontal treatment also, we can splint. And the patients who are undergoing regenerative periodontal therapy for whom stability of the teeth is needed, we can splint. So when and all it is contraindicated, the splints cannot be given for patients